mode.
Thank you, Anthony. Good morning, everyone. My name is Goriah. I'm the corporate CIO of WMC Health here in lovely Valhalla, located in the Hudson Valley. I hope you all are safe this morning and staying safe with your family and working hard and working from home and doing everything we can. Today we have an exciting presentation for you that Anthony will introduce. But before we do that, I'd like to introduce our new co-chair, Mr. Mark Ferrari. Mark comes to us with multiple years of health IT and information security experience. He's been with us for a while, and he's decided to form his own organization called Latitude Information Security. And he's actually serving as my CISO for WMC Health. Mark comes to us with over 20 years of military experience and has multiple certifications. So Mark, would you mind saying a few words to introduce yourself, and then Anthony can introduce our speakers?
Thank you, Steve. Since I'm not on
Mark,
camera,
before you do,
yes.
Mark, before you do, it's Nick Christiano. I would ask everyone to mute their phone because there's a lot of background noise, and that would help immensely with the presentation. So I'm sorry for interrupting, Mark. Go ahead.
Not a problem. Thanks, Steve. Since I'm not on camera, everyone can't see me blushing from that nice intro. But what it boils down to is I've been in healthcare IT for a long time, and for the past 10 years, it's focused specifically on security and compliance, and really looking forward to assisting Steve as CISO at WMC Health and in kind of helping advance this subcommittee and kind of exposing new and interesting topics and just kind of helping us, with additional crosstalk and advancing the topic of security. It's one of my favorite things to do. So with that, I'll turn it over to Anthony, and looking forward to the presentation today.
Thank you,
Hello,
Mark.
everyone. Welcome to Adrian. I'm Adrian, and this is Benji. And today we have a beautiful practical.
All right. Let me introduce Heather Rosso from Windstream. She's helped put together a great panel for this morning's conversation, and I'm going to let her do the introduction for her speakers. Heather?
Hi, good morning, everybody. Thank you for attending. Tony, thank you so much for working with me to put this together with the New York HIMSS chapter. And with that, on the screen, for those of you that are looking, is a great quote by Ann Mon Johnson, ATA CEO. The new realities of healthcare delivery in a post-COVID-19 world will necessitate the continued use of telehealth to support social distancing and maximize healthcare resources. So with that, I'd like to introduce the panel. Okay, I would like to, oh dear. Tony, I should have gone over this with you first. Okay, one sec. Okay, next slide. Oh dear. Tony, can you take control of my slides?
I don't think so, but okay, so you turn to us, the presenter. So maybe you just refresh your screen. All of the folks, if you could put yourselves on mute, I would appreciate it.
One sec, oh dear.
You had it before.
Yeah.
Bring the screen back up. There you go.
There we go. Sorry about that.
Perfect.
Okay, so I'm Heather Rosso, Account Director with Windstream. Again, had the pleasure to work with Tony to put this panel together. We have Dr. Engel, also known as Jim, Manager, Network Security, Vulnerability Management with Trinity Health. We have Kristin McInerney, also known as KMAC, Healthcare Services Consultant with Windstream, and Tom Gowen, National Security Solutions Engineer with Windstream. So with that, I'm going to kick it over to Jim Engel.
Before Jim, you start, can those folks out there, can you put yourselves on mute? We're getting some feedback, so please put yourself on mute if you're not talking.
I don't I was a part of it, so I wanted to make sure we were on.
Good morning. I'm Jim Angle.
What is it there?
First wanted to start this out real quick by
Ed Silva, could you please mute yourself?
let's start out by what is it we're talking about with when we say telehealth. Oftentimes you'll hear people use telehealth and telemedicine interchangeably. They are not the same thing. Telemedicine is the delivery of traditional clinical diagnosis. That's that video conferencing one-on-one between a doctor and his patient. Telehealth encompasses a whole lot more. Website monitoring, medical applications. Distinctly, there are 4 modalities associated with telehealth. That's mobile health, which is your smartphones and your tablets. Remote monitoring, which is at one time, it used to be just medical devices that were monitored and sent data to the cloud and then to the doctors. Now it's even more. We have systems that a doctor can put in, and for example, there's one company that does nursing homes. They put a system in there. They can do, with just a nurse's aid in there, they can do the blood pressures. They have a spinometer, the stethoscope, ear, nose, and throat devices all connected to the video conferencing system. So the doctor can literally do an exam remotely with just the help of a nurse's aid, and he doesn't have to go there particularly. Also, and the other 2 are the live video conferencing and, sorry about that, the live video conferencing and the store and forward. And we've been using store and forward for years, specifically with radiology, where we put images up in a storage device and a contract radiologist will pull them down and read them. That's all part of telemedicine. Next slide. When we talk about telemedicine, the first thing we need to realize is that there's privacy issues with it. Privacy is those decisions that are determine who has access, how they have access, how they use the information that's there. They put in place a framework for the legitimate use and alteration of data. So those are the rules that govern who can and cannot see your health information. Next slide. Can you hit the next slide, please?
Yes, it froze again. Sorry.
Well, the next slide is talking about security and the security concerns. And when we're looking at, when we're looking at security, we're looking at, privacy. Let's finish up with privacy. Primarily, we're dealing with the HIPAA privacy rules. It sets a standard for privacy of your medical records. With telehealth, we also have to consider things like the GDPR. We see European patients, particularly in New York there. But not only that, but where's your data stored? A lot of these things are in the cloud now, and if your primary data isn't, your backup data may be stored in the EU. And if it is, then you're subject to the GDPR. That gives data subjects have the right to know what you're using their data for, who has access for it, and how it will be used. And they also have the right to access their own data. And unlike our rules, they also have the right to tell you to delete their data and take them out of the database. So keep in mind, if you your data touches anybody in the EU or is in the EU in any way, shape, or form, you're subject to the GDPR. All right, next slide, please. Security. The security that is, HIPAA says we have to put reasonable controls, administrative, technical, and physical safeguards in there. It also requires us to do a risk assessment. The risk assessment has to include the threats. I see so many people out there, they do a control assessment and call it a risk assessment. not the same thing. Control assessment is part of it, but you also have to identify threats, vulnerabilities, likelihood and impact, and then what controls are put in place to mitigate that, and then do your assessment of the controls. So don't forget, you still have to do that with your telemedicine devices. Next slide.
Name is tagged to it. It's sitting in my opportunity list. There's no next steps. I don't know, maybe he's creating the opportunity. I don't know the part. I didn't dive into it.
Matt,
Yeah, let me get with Chris on that. I'm not really sure what that is.
I quickly went in and noticed who, because since it's just sitting in my pipeline, I wanted to see who it was tagged to. So your name on
Matt
it. So I'll just please with Chris if it's something that we're going to be associated.
Okay, security assessments, when you're doing it, the things you need to look at are governance, compliance, confidentiality, integrity, availability, and incident response. And we'll go a little bit into each one. Next slide. When we're talking about governance, can you flip to the next slide?
keeps freezing on me. I apologize.
All right. Governance includes your policies, procedures, controls. It's essentially how your organization runs things. Some questions you need to look at is, does the service provider clearly define how they protect CIA of your information? Does the provider specifically retain ownership of it? Define who maintains ownership. Keep in mind, just because it's in the cloud does not mean you are not responsible anymore. You still are. Will the provider use the data for any other purpose? And is it dependent on a third party? Oftentimes these go up there and there is a third party involved in it. You need to understand where the data is, where it's going, and who has access to it. Next slide, please. In compliance, telehealth must deliver services that comply with multiple jurisdictions. That's one of the issues you have. If you touch the EU, you've got at least two major things to take into account. Does the provider allow you to directly audit the implementation? Will the provider provide you with recent audit reports? Are they HIPAA compliant? And does it comply with the GDPR? You've got to ask the questions because they're not going to volunteer it. Next slide. And there may even be, just a side note, those aren't the only two. If you're stored somewhere else, you have to make sure that you know the jurisdictions you're involved with and what rules they have. Confidentiality, that's standard stuff, authentication, and authorization. Is it a multi-tenancy unit? How do they patch? How do they manage vulnerabilities? Encryption. Encryption, you need to ask more than, is it encrypted? You need to know how it's encrypted, and it needs to be encrypted end to end. And I say that because I looked at one. They used an encryption algorithm I'd never heard of. So I went up and looked at that, and it first thing that popped up was a little program that would unencrypt it. All you had to do was take that data, cut it from the original source, paste it into this little program, say how many bits the key is, click decrypt, and you have plain text. It was that simple. So just saying it's encrypted isn't enough. You need to know how it's encrypted. Make sure that it's FIPS, Federal Information Processing Standard 140-2 compliant. And then understand the data persistence, particularly if it's in a multi-tenancy unit. If you decide to change from that, how are they going to delete that data? How are they going to ensure to you that all of that data is gone and it's no longer available to anyone? Simply deleting it does not do. So how do they do it in a multi-tenant environment? They can't destroy the drive. So ask those questions and understand the answers. Next slide. the integrity, make sure you have backups, make sure you know where those backups are, make sure you understand the requirements related to data loss and how they're met. And again, encryption also fits into that. We've already said encryption, but make sure your data is encrypted and you know how it's encrypted so it's protected. Next slide. Availability. Does the SLA provide the expected availability? Does it provide an outage window? Are they providing for protection against denial of service or distributed denial of service? Then on your end, do you have adequate availability? Do you have adequate bandwidth? A lot of places jumped into this telehealth and found out that they had to buy more bandwidth because they wouldn't support it. Is the latency acceptable? You've got to have a lot of bandwidth and low latency to successfully do telehealth. So make sure your systems and your end is adequate before you jump into it. Next slide. And the incident response, does the provider have a formal plan? Did they test the plan? Is it clearly defined how they will support you in the event of an incident? What information are they going to be able to supply you? Will it be enough to do an investigation? And does it define their reporting requirements? Make sure that you put in your SLA what they're required to do. And it's difficult to let investigators have access to their systems because you may not be the only tenant. Next slide. And the last thing to make sure you do is establish and implement tools for the information security privacy compliance program. I saw one system that was put in place. We tried to put the security logs into our SIM and it wasn't ready for it. We had to do a lot of modification, a lot of changes the vendor had to do to make sure that that data is transmitted into our SIM. So test that out, make sure it gets there, and make sure you maintain monitoring throughout the life cycle of the data. You're responsible for that data from its creation to its destruction. So make sure you have all the steps in place to take care of it. And that's all I had for you.
Thank you very much, Jim.
All right, thank you. Thank you so much, Dr. Engel. And thanks to all of you out there for standing fast and resolute in these times of uncertainty and constant change. As a community health nurse and retired naval officer, I bring my background and experience to healthcare IT providers from Maine to South Carolina. So my job as a healthcare subject matter expert for Windstream is to translate healthcare IT to my account executives so that then we can help you improve the patient and provider experience. So telehealth is all about access. And I was thinking about this this weekend with Mother's Day, and happy Mother's Day to all the mothers out there. I was deploying a telederm solution in the late 90s, and that was using with my sister's services, and we were using a T1. Imagine that. I'm sure there's a few folks in the audience that can relate. I'm really happy to see the expansion of telehealth today. It is well overdue. And as you can see, it's used for a variety of areas, and just it's working. It's really working. Next slide, please. So Dr. Engel, you did a great job touching on HIPAA and giving some really, really great information. So I'm really going to try not to repeat anything that you already said and what everyone out there already knows. But as we reimagine what patient engagement and provider communication will look like, even as all these privacy waivers start expiring, I would really like to quote Linda Reed, who spoke last week at the New Jersey HIMSS meeting. She is the CIO of St. Joseph's in my home state of New Jersey. And she said, look, everyone needs to teach all their staff to use WebEx or something like it right now. And I would like to add, also think about security and access, because there's a lot going on. And the difference now is the rules have relaxed a little bit, and you have these public facing remote communications that are designed to be open to the public that are not acceptable to use for telehealth. But yet we have transitioned into this non-public facing remote communication, and that's like Skype and Zoom, that are typically encrypted end to end. So look for those compliant features that are listed below: the fully encrypted data transmission, peer-to-peer secure network connections, which Tom will be going over here shortly, making sure that, you know, there isn't the recording and chat and other features are disabled, and ensure that your vendor signs a business associate agreement. Next slide, please, Heather. So what type of security questions can you ask? Well, this is my short list. This is my short list of security questions to be asking your vendor about a telehealth solution right now. So now truly is the time to stress test your vendors. Now is the time to also engage with your network and cloud solution providers. Now is the time to really update your network security and testing plans. And so these are just a few things with very detailed numbers, and make sure that you're asking, you know, your vendors this. This is very important. But I would really like to now invite Tom Gowen, who is our National Security Solutions Engineer, to discuss a little bit more on this particular topic, because he truly is the expert. Tom, you have the floor.
Thanks, KMAC, and appreciate the kind words. So yeah, my name's Tom Gowen. I basically am our security solutions and SD-WAN specialist for Windstream. We see a lot of, especially our healthcare clients, basically having these questions of what did I do before from a network security perspective, and how do I keep the HIPAA compliant security rule? Versus how is this new telehealth, telemedicine environment change the way I should look at this? So Heather, you can look at the next slide. So like KMAC and Dr. Engel was saying, really the HIPAA rules, if you boil it down, for me, it really comes down to what everyone's been saying. Who is accessing the data? Where and what are they accessing? How do you make sure you have visibility and control over that access? So you can see, even if someone is accessing it, as long as you can report on it and log on it, then you're helping to be clear. The trick with telemedicine and telehealth is that both areas are expanding in the number of devices and the number of things that we can do with the technology. With telemedicine specifically, we're talking about new types of monitoring, internet, medical things. Now we have devices that are not even people connecting to your network resources or publishing to your data, but also monitoring devices like Dr. Engel talked about. We could actually put a lot of these different things that you would normally do an exam into the network. And how do we make sure that those devices have access to the network? And then from a telehealth perspective, now we're expanding more than just telemedicine. We're talking about, I want to collaborate with my peers. I want to have meetings with the admin staff. I want to do things that are basically standard collaboration tools. I need to make sure that those collaboration tools are also locked down and meets compliance standards. So for me, again, as a healthcare professional who's managing IT, what I would really look at is what are all of the services? I have cloud video conferencing presentation type services. I have cloud services that may be keeping patient data, keeping scheduling information, the patient engagement experience. I have cloud storage, like Dr. Engel said, doing store and forward. I'm basically uploading specific patient documents like x-rays and labs to have other third-party technicians or people be able to download that information. So how we access the network in the old days basically be, let's create a private network. We know the private network's secure, and then we'll give people secure access to those network elements. In this day and age, all of these applications have some form of cloud in them. And how do you not only control the access to the cloud, but also give you visibility and support in the monitoring of those controls, right? So if you go to the next slide, Heather, basically For us, from Windstream's perspective, we like to do it from a managed network security perspective. So we look at the network, building out the network security, and it's a combination of using appliances at the edge and in the cloud to give me the visibility to the control measures of what I want to control, who I want to control, where I want the visibility of that control. So from the edge, or on the left side where it says CPE or customer premise equipment, you know, in the old days, you would just put a firewall and you would say, give the person access to or not access to certain things. Nowadays, this generation firewall needs to have some threat prevention built into it. It needs to have a way to see not only that the user access control is available, but that no one unauthorized is trying to control that data, right? And so you need to have an updated threat management plan that involves signature recognition for botnet or malware type software or things that threat actors would use to you need to be invested in the premise security, but then also for all the cloud applications, you need to have the same kind of intelligence built into the cloud, whatever you're using, to basically make sure that the connectivity to all your cloud applications are not only monitored and maintained, but you have that same level of intelligence that you know when bad things are happening, you know when bad people are accessing the wrong way. And then finally, from a network security provider perspective, it really is helpful to have a security operations center, people that can look at that data, because basically what's happening is in this new world, there are a lot of appliances and hardware that can give you intelligence, information that can make sense of a lot of different data that's giving you that visibility of what happens on the end-to-end view of your customer's protection and the client's protection, the patient's protection. But you really need someone to then, incident response, be able to make sense of that data and respond quickly to that data. And from a security perspective, you know, obviously Windstream has a security operations center, but any network provider or anybody that you would get a managed security service from, a security operations center is really going to give you that personal view into the incident response, so you can make sense of the data that comes through and you can respond to it. The combination of these things, intelligent appliances, that gives you the access control and visibility, and then basically a SOC or people element on top of that that says, now when something bad happens, how do I respond to it and how quickly can I respond to it? That is the view in the nutshell. So my advice is really make sure of all of the applications that you're using, view everything as an application. And who's accessing, where's the source of that application, where's the application sit, what's the destination of that application, and then how am I making sure that I have visibility end to end, and that I have encryption, like Dr. Engel said, or some kind of protection end to end to make sure that that data is secure. So in a nutshell, really at the end of the day, it comes down to taking advantage of newer technologies in the security space as well to give you that level of automation, intelligence, and control.
Thank you, Tom.
That's the end of my piece.
Hey, Heather, do you want to open up for questions and answers?
Yeah.
You might be on mute, Heather.
No, I'm here.
All right, I'll start off the questions. It's Nick. So, and this is going to sound a little, what I'll say, abrasive. If I was talking to my bank, or if I was a consumer or a company that was considering doing online transaction business processing with Amazon, what we covered, although incredibly important, stuff that was taken care of years ago. And so my concern and worry is we're treating the entire HIPAA, the patient availability of data, who has the right to data, the apps to control security. It's like newfound territory. And yet I'll go purchase everything from toilet tissue to a car online, and I'm not overly worried. And I know it's patient data, but quite frankly, when it comes to money, people seem to be very, very focused on making sure their transactions are secured. What's the problem? What's the challenge here? Why is, with healthcare, we've created such a phobia about this, and in other industries, which are core foundational industries, we've managed to address it.
Can I answer that?
I don't know. That's why we put it in as a question.
Okay, let me try to answer that. I've looked at a lot of telemedicine systems over the years, and the problem is that a lot of the companies took commercial family to family like Zoom or Skype or FaceTime and tried to make telemedicine or telehealth out of it. And they didn't really have any security built into it. And when I talked to one company in specific about it, why didn't you do it? Why didn't you harden the OS? Why didn't you put some kind of control in place? There was no authentication on it. There was no authorization. Anybody can use it. And I asked them why, and they said, buried deep in HIPAA, there was an exemption put in there for telemedicine that said they didn't have to do that. So a lot of companies didn't.
My phone rings, grab it. I'm in the bathroom.
Where's your phone? All right, makes sense to bring it in here, but okay.
We understand that we need that security in place.
I don't really care.
But in the past, it never was.
Please put yourself on mute.
And that's why we bring it up today with telehealth and telemedicine, is that was never really built into the systems until just recently. They're now making an attempt to build it in.
Can I also mention from a banking perspective, we have a lot of banking clients as well. There is no safe, secure transactional method for banks. It's all about the risk assessment. And that's like Dr. Engel was saying too, a part of the assessment that you need to make up front is more than just a network access control assessment. It's a total risk assessment of what are you willing to take a risk on? Because at the end of the day, a lot of banks will have their web-facing portions on AWS or Amazon, but all of the actual transactional data or the record data is actually still privately hosted and has private secure functions built into it. Similar function, I think, to healthcare. A lot of the actual PHI data is to reside in a very secure environment, and how you give web access to that data is really where you need to utilize some technologies to get visibility.
Tony, who's got access to all the mics?
Hey, Dennis, can you mute yourself? Thanks.
Yeah.
I'm trying to do that right now.
Okay. All right. Thanks, Tom. I appreciate it. So I'll go back to Dr. Engel and ask the question. So can telehealth students stay? Guys, can everyone mute phones? Trying to mute everybody.
I'm trying to, Nick.
This is being recorded. So if you can't get yourself on mute, then just please drop, and then we'll make sure you get the recording. Thank you. There we go. Any more questions? Do you see any questions in the chat box? Let me look. I can look myself.
Hey guys, this is Mark Ferrari. I have a question, and I think it'll piggyback off the question related to the financial industry. You know, one of the elements that I think is true in the financial industry is that if and when there's a compromise to the data, you make a phone call, you get a new credit card reissued, the transaction's removed. It's fairly quick and easy in terms of how you make your record and yourself whole again. With the proliferation of telehealth, you know, I think what's ultimately the question is how and what do you see in terms of medical record remediation, correction, backing out errant or fraudulent ADT information or clinical information, et cetera. What do you see on that front, and is that you know, part of the avenue towards making healthcare more resilient in terms of attack?
I'm personally not familiar with that side of it, how you would remediate that if a breach did occur. You know, I know what we would do as a system, but I'm not sure how you could regain control of what exactly has to go into regaining control of that health record.
Yeah, I think it's a key but tough part of the question. Yeah, thank you.
Yes, it is. I just don't know the answer to that because it's there's been so many incidents where breaches have occurred where somebody ends up using your health insurance, for example, and then bogus stuff gets put into your medical record. How do you go through and validate that and get it out? I'm not sure, other than to manually go in and with the patient and go over their medical records and try to correct it. Part of that problem is we've made medical records to be permanent.
Yes, agreed.
Hi, Dr. Engel. This is Regan Pascoe. I just wanted to ask it's a very generic question, but we've been asking this to a lot of customers lately, of my customers, just to understand from your perspective, with this COVID-19 pandemic, what has changed in the priorities that you used to have with respect to, you know, whether it's network security or other types of priorities? What has moved to the front line now versus what used to be a priority for you?
Right now, that would be remote access and telehealth. We now have our remote workforce just skyrocketed overnight, making sure we had the ability to accommodate all the VPNs that were necessary, making sure we had the bandwidth for it. So we jumped in bandwidth for telecommuting, telework, and then we added all the telehealth on top of that, which then just really made it very difficult to maintain an adequate bandwidth for all of it. And we even went to the point where we turned off our cameras for a while on our video conferencing for business because the bandwidth was, we saturated it overnight.
Well, Dr. Engel, this is Howard Reese. I'm the CEO of the Teledentists, and yes, you can do dentistry over telehealth, but going back to the privacy question, from the patient point of view, you see that the patient is very concerned with privacy and security, or is their primary concern getting access to the right expert as quickly as possible? And a quick PS there, but a bunch of the commercial telehealth providers have built HIPAA into their HIPAA considerations into their systems, and but the regulations for HIPAA have actually been relaxed as part of this pandemic. And was wondering if you have any comments about that.
Yes. my experience has been that most patients are more concerned with access than they are privacy. They just don't think about it, and that goes back to the earlier where we jump online and do financial transactions all day long. They just don't. Most people just don't think about what can happen and what does. That we just accept that it's secure. So that's why it's incumbent on us to make sure it's as secure as it can possibly be. I do agree they've relaxed the standards for telehealth, and I would say we're not because we know. I understand that when the pandemic settles down and everything starts getting back to where it was, telehealth is not going to stop. We've let that genie out of the bottle. It's not going back in. And I think that's a good thing. It helps with physician shortages. It helps with resource management. I think it'll be a tremendous benefit to us, but we have to get it right. So it's get it right now. And then when the regulations do tighten back up, you're ready. You're not jumping through hoops.
Any other additional questions?
Dr. Angle, it's K-Mac here. How often do you, or if you're allowed to say, how often do you do security assessments or network assessments?
We do some sort of assessment daily. We're running scans and monitoring constantly, whether it's vulnerability monitoring, scanning, or network monitoring. And so we are constantly doing it.
Do you do this internally? Do you also bring in outside vendors to come in and do that for you?
Yes, we do. That's something everybody should do, because we bring in somebody to assess our network on a annual basis, so that we make sure that we don't become complacent.
We recommend, at least every 3 years, but now I would be doing the same as you. And changing your vendor, not keeping the same vendor from year to year. That's yep, definitely a great recommendation. Well, thank you.
Yes, indeed. Thank you, everybody.
Yes, thank you very much. This will
Thank you.
end our presentation. I would like to remind everybody on the line here before you jump off that the New York chapter has opened up a new LinkedIn page just for our chapter. So please go out there and take a look at the New York State HIMSS chapter. It was just recently launched. Please follow, and you'll see updates will also pop up for the PCS group as well as the other educational resources that we have. I'd like to thank the folks from WinStar and also Dr. Jim Angle for their participation this morning. And then Mark Ferreri or Nick, would you like anything else to say before we jump off? And then also look for our next webinar coming up on the 18th of June with the HLNY group. We'll be sending out information on that shortly, as well as our monthly PCS meetings will be back to the first Monday of each month again. Nick or Mark?
Yeah, I'll just jump in. This is Mark. I just want to thank our panelists again for giving some insightful and specific recommendations. I think that's always a key part of it. This is definitely a topic that is only going to expand, especially given the world today. So thank you for your time and your expertise. Very, very grateful to have you share it today.
Thank you. Greatly appreciate it.
Thank you. We appreciate the opportunity.
Thanks.
It's been a pleasure.
And this will be recorded and be placed out onto our website. So folks, if you missed a piece or any part of this and would like to listen to it, you'll be able to pick it up offline. Look tomorrow for it to be up on our site. I'll say thank you to everybody and have a great day.